Now let's practice the Kegel in standing. This is a more advanced way to do it because now that you're standing, you have the weight of your organs weighing down on the pelvic floor muscles. It's like adding 10-pound dumbbells to your bicep curl. You're adding some resistance to the muscles for them to contract and relax. So this is a really great way to advance the Kegel from the lying down position. And obviously this is much more functional. This is when we want to avoid leaking, is when we're walking around, standing, running errands, and the like. So here are some visuals that I'd like to give to some of my clients. You can perform these visualizations lying down, sitting, or standing, but we'll do it standing today. So I'm standing here again in front of you, and we're going to try a Kegel. Let's use the visualization of an elevator. So currently, my pelvic floor is relaxed. And if I tune into that, I feel that it's dropping slightly. It's softening. If I had to pee, I would pee. If I had to pass gas, I'd pass gas. So I'm truly not holding on to any tension in the pelvic floor. From here, let's envision this as an elevator, and we're in the lobby and the doors of the elevator are open. Everything's relaxed. From here, let's envision closing the elevator doors, okay? And then let's go ahead and lift it up to the first floor. And then let's lift it up to the second floor. Good. And then let's go all the way back down to the lobby. Very nice. Doors open at the bottom. Okay, so this is a gradiated increase in contraction. From the lobby, we do about a 20% contraction to close the doors. We do a 40% contraction to lift it up to the first floor. We do a 60 to 80% contraction to lift it up to the second floor. And then we're going to go all the way back down to the lobby and allow the doors to open. Okay, using just the percentages so you can hear this again. We're going to contract 20%. We're going to contract 40%. We're going to contract 60 to 80%. And then we're going to take it all the way back down to 0. I am really tuning into how this feels. I'm tuning into the cinching in of the opening of the vagina. I'm focusing on what I feel. As I do the 20% contraction, I'm noting how the opening of the vagina is cinching in. Just a very mellow contraction. I'm then increasing the contraction, and I'm going to feel the pelvic floor lifting slightly. And then I'm going to try to deepen that contraction and feel the pelvic floor lift even more. When I do this, I feel my belly pull in as well, but I'm still able to breathe. From here, I want you to drop it completely and note if that's difficult to do. If at any time you're not feeling the relaxation of the pelvic floor, the dropping, the widening, the softening, you're probably not doing the pelvic floor contraction correctly. So this is a great way to tune into what your body is doing. Can you feel it contract? But also, can you feel it relax completely? And if you can't, go back to Kegels 101, where you're practicing it lying down. If you can't feel that at all in either position, this is a good opportunity to seek out a professional's help. Pelvic floor specialists are all over, and they're here to help you perform a Kegel the proper way. So you should really be able to feel both the contraction and the relaxation element of the muscles. Here's another visualization for you. I like this one, and you can do this anywhere around anyone, and they won't even know you're doing it. Envision a tiny, dry kidney bean or pinto bean, whatever you'd like to picture, okay? As I'm talking here now, I'm really working on relaxing my pelvic floor muscles. I notice that my belly relaxes also. Now envision this dry kidney bean inside the vaginal canal, and I want you to go ahead and hold it. Go ahead and hold it there. You're contracting your pelvic floor. You're lifting that kidney bean up towards your belly button just a little bit. You're holding it there. You're holding it there maybe for 3 to 5 seconds, and now I want you to drop it. Just drop it. Good. Excellent. And now let's try that again. Go ahead and just hold on to that kidney bean. The vaginal opening cinches shut and it lifts up to hold the kidney bean in place. Hold it there and now drop it. Good. You might notice a little lag time in how you're letting go. You might notice that that's hard to do. You might notice that the relaxation happens in waves. That's okay. But this is a great visualization to start practicing holding it and contracting with a cinch and a lift, and then dropping it as fast as you can, really feeling like the bottom is dropping out. Again, don't be alarmed by this or worried that you're promoting a saggy pelvic floor. You're not. It's important for muscles to be able to contract and relax properly so they can function at their best. Go ahead and try this at home. You will be wanting to do 5 to 10 repetitions of these kegels, holding each one for 3 to 5 seconds to begin, and doing this 3 to 5 times per day. Let me repeat that. With each contraction, you're going to hold it for 3 to 5 seconds and repeat that, contract and relax 5 to 10 times. You're going to repeat that 5 times per day. So we're not trying to do 20 at a time. We're not doing 100 at a time. We're trying to do quality contract and relax exercises for the pelvic floor throughout the day to gain the best overall strength and function in the pelvic floor. If you do this consistently for 2 to 4 weeks, you should notice that you're leaking less and that you have more control of your bladder and your pelvic floor. You might also notice some reduced pain or less pain with intercourse. So try this out. It's simple. Mark it in your calendar to do regularly, and you will reap the benefits of the Kegel. If you want more information like this, please tune in on Instagram or Facebook at Jenn Lane PT on Instagram, or go to my website, jennlanept.com, where I have a lot of resources for you to check out on a regular basis, new tips and tricks for you to take care of yourself and your pelvic floor. Bye for now.